Asthma is a condition characterized by breathlessness and wheezing. To understand how asthma causes shortness of breath, one must look at the normal respiratory system. Air enters the lungs through a large tube known as the trachea, which is supported by concentric rings of cartilage connected to each other by annular ligaments. The trachea splits into a right and left primary bronchus, and from there each primary bronchus subdivides into secondary and tertiary bronchi. Tertiary bronchi continue to branch into smaller tubes called bronchioles. Unlike the larger tubes, bronchioles do not contain cartilage and must rely on smooth muscle in their walls to keep these airways open. The smallest and final branch of bronchioles, called terminal bronchioles, end blindly into the alveolar sacs. Alveolar sacs are made up of grape-like clusters of alveoli. Within these alveoli, gas is exchanged and vital oxygen enters the bloodstream. Throughout the bronchiolar tree, mucus is secreted from specialized cells in the walls to trap foreign particles and irritants that may be in the air we breathe. The walls consist of cells that are covered with cilia, whose main role is to push mucus up and out of the bronchiolar tree, disposing of the trapped particles and irritants. Looking at a cross-section of a bronchiole, it is evident that under normal conditions, there is little resistance offered to the incoming rush of inspired air. The wall of the bronchiole is relaxed and provides an open airway. Asthma is a chronic condition in which various irritants cause bronchioles to become inflamed. Some of the most common irritants are dust mites, pollen, smoke, stress, and infections. These irritants can cause a cascade of events, such as the release of leukotrienes and histamine from leukocytes and mast cells. The result is inflammation, overproduction of mucus, and bronchial constriction. All three block the airways, making it difficult for air to move in the lungs and thus triggering an asthmatic attack. There are several treatments for asthma. The most common is epinephrine and related compounds. Epinephrine stimulates beta-adrenergic receptors in the bronchioles and promotes the dilation of bronchioles. Epinephrine can be inhaled as a spray to open up clogged bronchioles, which in turn will relieve the symptoms of an asthmatic attack.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into two large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic-type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed.
In health news now, allergies and asthma can go hand in hand, and the lingering pollen season is a problem for millions of Americans dealing with some form of asthma.
But now doctors are better able to tailor their treatment. News 8's medical reporter Jocelyn Momenta is on the scene with what one Connecticut hospital is doing.
There is no cure for asthma, but doctors are able to control their patients' symptoms. Now they can even go further with individualized treatment.
Take a deep breath in.
Nicholas Giancarelli has allergies, and in the spring, it triggers a mild form of asthma, inflammation in airways of the lungs.
They're saying that they think I'm breathing funny.
But the 7-year-old takes it in stride.
One adult said that I was like it sounded like I was gasping for air.
Usually in the spring, he'll start coughing like crazy. I hear him coughing at night. I hear him coughing all day long.
Coughing, shortness of breath, that's when kids like Nicholas
Just breathe in and out.
see pediatric pulmonologist Dr. Jacob Henn at Bridgeport Hospital, where pulmonary function testing confirms the diagnosis of asthma.
This is measuring resistance in his airways.
You're going to put this in your mouth.
But it is this handheld device, the Mino, that paints a much clearer picture for Dr. Henn.
Some asthma, the white cells are specific white cells called eosinophils, and they are linked to allergies. And these white cells produce a gas called nitric oxide, and we can now measure that. The exhaled nitric oxide allows us to actually measure inflammation in the airways and tell us if the inflammation is increased or not. So then we can tailor our therapy specifically to reduce that inflammation.
Patients with severe asthma with increased inflammation can expect a higher dose of medication. For Nicholas, with seasonal asthma, that means an inhaler to open his airways. Patients with persistent asthma also get a daily inhaler. It prevents symptoms and reduces inflammation. On the scene at Bridgeport Hospital, Jocelyn Momenta, News 8.
Physicians treating the estimated 34 million Americans living with asthma have been challenged by the inability to simply measure airway inflammation. Additionally, getting patients to stay on their therapy has been a challenge. But now, a new clinical practice guideline issued by the American Thoracic Society says a patient's exhaled nitric oxide measurements, also known as FeNO, could help solve both of these challenges. That's where Niox Mino comes in. The patient blows into the device and the data are available in minutes.
E&O testing is important for people with asthma because it gives the physician insight into the amount of airway inflammation that is occurring.
When Dr. Boggs administered a FeNO test to schoolteacher Beth Hughes using Niox Mino, the test revealed airway inflammation that he otherwise would not have known about.
I never realized the severity of my asthma until my doctor had me take the E&O test. And now, after being on my medication regimen, I have more energy, I can breathe deeply.
Dr. Boggs says that one device makes FeNO testing easy.
The Niox Mino is a simple handheld device that gives us an index of their airway inflammation. We have never had that ability before using simple tools.
This is Andy Neville.
You okay, Steve? Just wait there. Full breath, full puffs. I did 1, 2, 3, 4. Good. Okay, cool. Good, that's 2, 3, 4. Give it a shake. Good. Good. 2, 3, 4. All right, give it a shake. Good, you're doing well, you're doing well. Try and slow it down. 2, 3, 4. Alright. Just wait for 4 minutes. Doing good. Try and take some deep breaths. Slow it down. Ambulance, please. Yeah, my husband, he's an asthmatic. He's been gardening today. No, he's out of breath, really can't speak, wheezing a lot. 225 Main Street, Windsor. Yeah, he's 30. Yeah, we've been doing the asthma first aid.